All right. I'll just give it another minute here, and at 4:03, I will introduce you all to Natalie. Some more people coming in. Okay. So it is my pleasure to introduce to you Natalie Baker, LMHC, who is a licensed psychotherapist with 25 years of experience in private practice, specializing in helping clients navigate anxiety, trauma, and relationship challenges. For the past 12 years, she has been a certified neurofeedback trainer and instructor, combining neurofeedback with a range of talk therapy modalities to support emotional resilience and healing. Natalie's integrative approach blends neuroscience and psychotherapy, offering innovative tools to enhance client outcomes and improve overall mental health. Thank you so much for being here, Natalie. I'm going to turn it over to you now.
Terrific. Thank you, Emily. It's such a wonderful organization. I feel really privileged to be able to present this to your community. So thank you, everyone who's joining. I'm going to share my screen now so I can start my slideshow. We're going to invite you to ask any questions that you want to ask in the chat. Emily's going to field those questions for us so that if there's something arising in the moment that you want a little bit more explanation on, or you're just sort of curious to dive a little deeper, please feel free to ask a question. I like it when people join in. So the topic today is neurofeedback and how it can impact client outcomes and support the therapist in making progress. So the first thing I wanted to come to is to just talk a little bit about our pain points, because it's always more meaningful to me as a therapist when I can identify a problem I have, and then think through how this could fit in with, potential tools for solutions. So just to go over a few that may be helped by neurofeedback. So clients feeling stuck in therapy, if they have difficulties opening and accessing their feelings, or if they're easily triggered and derailed. If you're not sure what the diagnosis really is, and you're kind of weighing a few that may be there for the client or the family. A family system that is very chaotic, where there isn't enough regulation to be able to, create a foundation of change or to do the healing work. And for some who've tried medication and not found it helpful, or medication isn't appropriate, or they don't want to take medication, sometimes that's a reason to add the neurofeedback as a piece. And also for us as therapists, we don't really think about tools that we offer our clients as necessarily tools that are going to support ourselves, but certainly neurofeedback can be a tool that really helps and supports the therapist. And so I'll talk a little bit more about that. But if you're feeling burnt out, if you're thinking too much about your clients in between sessions, or you feel like you're holding their feelings or holding on to their feelings, neurofeedback may be a support for you as well. So just a little bit of what we're going to go over in the next hour and a half. We're going to talk about just basically what is neurofeedback. I'm going to share my own story of how I came to become a neurofeedback provider. I'm going to talk a little bit about the history of neurofeedback and the different systems, which is really important. Touch a little on the research that's been done. And then I'm going to take you into specifically the system that I use, and using the stress response as an example of how neurofeedback works and how it can benefit your clients. And then talk a little bit about what gets in the way of the neurofeedback doing a good job for people and getting the results. And then I'm going to give some case examples throughout. And then, of course, at the end, we'll have Q&A, but also if you have questions during the presentation, please let me know. And And so let's just start by what is neurofeedback. So neurofeedback is an extension of biofeedback. And we all know biofeedback as a conscious process that we engage a tool to help us consciously identify when we're becoming dysregulated, whether it's heart rate change or skin temperature change. And then we'll consciously do an intervention, whether it's deep breathing, to then activate the parasympathetic nervous system to come out of a stress response. So neurofeedback is specifically using the brain waves. So the brain communicates through electricity and chemicals, and we're going to track the electrical communication of the brain, specifically the unconscious brain, the limbic brain, and we are going to give feedback directly to that brain through auditory visual feedback, so that with the goal being that maladaptive brainwave patterns can shift into being adaptive brainwave patterns and optimize performance, decrease symptoms. And so one of the things you need to know that's helpful to know about neurofeedback is it's an unregulated term. And so anything can call itself neurofeedback. And so it's very confusing for people because there are a lot of devices out there now. It is technology, and you get a whole range from like things that are basically entertainment to, professional grade neurofeedback systems. So always, whenever someone's saying, I'm interested in neurofeedback, diving into, well, what is the technology? How does it work? What does it cost? Can help assess whether or not it's a good fit. And so just other terms, we know it as EEG biofeedback, neurobiofeedback, neurotherapy, there's MRI neurofeedback. So there's a number of different terms that fall under the umbrella of neurofeedback. And of course, each system has its own proprietary software that they use for their system. So first, I wanted to just talk a little bit about brain waves, just to kind of give us a reminder of what is that electrical communication that's taking place in our brains. So we have the delta waves that are associated. So when those are active, we're in a state of deep sleep. Theta waves, when those are predominant, they're linked to creativity, relaxation, meditation. These are the lower, slower brain waves. Alpha brain waves are connected to relaxation, calm, focus. Beta waves, that's when we're actively thinking, problem solving, when we're alert. And gamma waves, which are the higher frequencies, right? They're as you can see on the picture, right? They're like going fast and furious. They're associated with higher cognitive functioning, information processing, and very interestingly, also associated with more profound states of meditation. Richie Davidson, who's doing research on long-term meditators, he has found that when you put someone into a deep meditative state, and these are people who've been meditating for like 20, 30 years, their gamma waves are very dominant, which was new information. So, we're just at the beginning of learning about the brain, but that's just a reminder of, what the brain waves are and what role they play in various functions. And so, of course, why are they important? They're important because they facilitate, as we saw on the other page, different states that are very important. And, stress, when we're in a stress response, we're going to have high beta activity. And that would also shows like overthinking, mental fixation, rumination. And so understanding that one of the ways that we can influence state change and emotional change is through those brain waves. Okay, so just to talk a little bit about my story. Um, so I'm a psychotherapist in private practice in New York City, have been for 25 years. And actually, I realized it's now about 15 years ago that I was introduced to neurofeedback. I've got to update my slides in terms of the years. Um, I was teaching a meditation weekend, and one of the participants asked me if I'd heard about this technology called neurofeedback. And I hadn't, and he told me a little bit about it. He'd been approached to fund a peak performance neurofeedback clinic in Manhattan. And so he was telling me that there was this technology that could, help the brain shift out of, the hyperarousal of anxiety and depression. And so I was very curious, even though I don't consider myself a techie, I'm not that interested in technology, but I'm really interested as a psychotherapist in solving that problem that we're all confronted with when clients have symptoms, which is in part, how do we get that brain to stop doing the wrong thing in the present moment and register the here and now and come into alignment? And so I read the book Symphony in the Brain, which is a really great history of neurofeedback by a New York Times science writer. It's actually very dated at this point. It doesn't even include the technology that I use, but if you're curious about the history, it's a good book to read. And so I just started researching. I talked specifically to psychotherapists who were doing neurofeedback because I wanted to hear their experiences. And I did neurofeedback on myself. And then I also sent a couple of my clients who had pretty bad post-traumatic stress disorder and were really looking for change. I had them go out and do neurofeedback. And I'm going to tell you a little bit about one of my clients who went to do the initial sessions and her experience. But I'll tell you a little bit about my own, which was that, so I had zeroed in on one technology, and because it was fully automated and it worked on all maladaptive patterns simultaneously. And so I wasn't going to be tweaking brains, and therapists that I talked to had switched to this technology and were really happy with it. It's called NeuroOptimal. And so I started with that one because that really fit my goals and my interests the most. And so I went to a therapist and she gave me some sessions. And it was about the third session, I had an experience of like what we'll call like a clean windshield effect, where when I left the session, my sense perceptions felt very like calm but crisp, like everything had a very sort of enlivened or vivid quality to it. And then about after my seventh session is when I really had my own kind of more profound aha, which is at that time I was living up in Westchester County and I had a small daughter and I was driving home from the train station late. It was like 10 p.m. and I had this kind of typical thing that would happen for me, which is I was tired and I'd feel kind of exhausted and then I'd feel a little sad and sorry for myself. And I had this narrative that would go on about why do I have to work so hard and life is exhausting. And then this one time after I'd done this neurofeedback training, I was driving home and I noticed that I was tired, but nothing else. And I was like, oh, this is interesting. I'm not playing that woe is me story. And I'm not, And so I was like, I wonder if this is the neurofeedback. And so as a test, I started to generate the narrative to see if I could get the feelings going again, and I couldn't. And I thought, must be because of the neurofeedback. And so that was my own sort of like realization that made me appreciate what it could do in terms of creating greater resiliency and regulation. So just to give you a fill in the gaps here, from then to now, so I bought my first neurofeedback system in 2010 and introduced it into my psychotherapy practice. And then because the system's fully automated, we organically grew a home rental program, and we now ship systems nationally so people can do home neurofeedback. As well, I teach the certification course for the neurofeedback system that I use. So I want to tell you a little bit about Clara's story. She's the one who was my neurofeedback guinea pig. And she came into me for psychotherapy at 29. She'd been into a lot of different therapeutic environments as a teenager and young adult. She had a very extensive history of early childhood abuse, both sexual abuse and neglect from her family, sexual abuse by a neighbor. And she really struggled with complex PTSD. And she was very easily triggered into a rage response. She'd been physically violent in the past in her intimate relationships. And she was really eager to reset. And this is somebody who was working so hard on herself. She did yoga teacher training and taught yoga as a way to regulate herself. She tried, various diets to support her nervous system, psychotherapy, meditation. I mean, she was really trying to do it all. And it was after her 5th session of neurofeedback that she came to me and she said, I had the most profound experience on the subway the other day. So one of the triggers for her rage was large men being close to her in a packed subway. And she said, it was a packed subway, and this large fellow came on the train. And I noticed instead of that rage coming up in me, that my body simply turned and faced the other direction. And she said, I realized, like, wow, that's my body responding appropriately to the here and now. And so she, she really did very well with the neurofeedback in terms of helping her nervous system re-regulate so that all of her good intention and the tools that she was employing around communication skills and doing the healing work in therapy, they were able to actually take hold because she was really re-regulating her nervous system, or better said, her nervous system was re-regulating. So I want to talk a little bit now about the history of neurofeedback. And so this is technology that the development of it goes lock and step with the development of computer processing speed. So if you think about the brain, you probably don't think about the speed at which the brain communicates and the number of communications that are taking place at any given moment. And so just to give you an idea, the software that I use, the technology, it takes 256 data points per second looking for, the signaling that it looks for. 256 times per second. That's how fast the human brain is operating. And if you think about, the World Wide Web, or you think about like JFK, when it's at the peak of activity, although that's not nearly enough activity for the human brain. Like, there are so many activities happening simultaneously and continuously that speed is a very big part of being able to give accurate and precise feedback. So neurofeedback was first discovered accidentally with cats, actually, with the work of Dr. Barry Sternman, who was a neuroscientist at UCLA. And so Dr. Sherman, he was training cats to produce a particular brainwave, which we now know as the sensory motor rhythm, SMR. And that's the state, is the frequency range is between 12 and 15. And we know it in a cat. It's that moment when they're very still just before they pounce. So it's calm and focused. And so he used operant conditioning whenever they went into that Hertz frequency range. You know, he's using EEG sensors in their skull to measure that. He would give them a food reward. And so they were trained to go into and stay in that frequency range. So then later, when he was involved with a NASA research project, which exposed cats to toxic chemicals, he noticed that the ones that he had trained on the SMR were remarkably resistant to seizure activity from those chemicals. And so that led him to hypothesize that you could train the brain to produce brain waves that could help with reducing seizure activity. And so actually the first, research that was done was around creating neurofeedback protocols to prevent seizures in people. So just to talk a little bit about the first generation of neurofeedback, this is the most common form of, and we're talking professional grade neurofeedback systems. The linear systems are also called protocol neurofeedback. And these systems were created when computers were not at the speed of the human brain. And so you had to take out some of the functioning because you couldn't give real-time feedback to the brain at this point. Computers were too slow in processing that data. And so then what they did as an alternative is that they took a brain map to and some of you may know them as QEEG brain maps. And it's basically you're putting the cap on and then you're taking pictures of the activity of the brain. And that shows you, the underperforming and the overperforming of different brainwave frequencies. And so then you take that mapping and you use that to then set protocols. So you're basically creating a zone in which the brain, you're either augmenting or inhibiting those brainwave frequencies, the ones we saw like delta, alpha, theta. And so based on whatever is showing up on the QEEG or a diagnosis. So some linear systems don't use the QEEG, but they'll use a diagnosis. Like if you have anxiety, they know you've got high alpha. And so they're going to inhibit alpha. And so then you have a trainer who sets these protocols and gives you, usually it's primarily visual feedback, maybe some auditory feedback to augment and inhibit those brain waves. And typically it's done with usually a set of sessions. They'll say you need a set of 20 sessions or 30 sessions. It's done in office. And for those of you who are familiar with Bessel van der Kolk's work, he uses the EEG system, which is the linear system, and he's doing research right now on post-traumatic stress disorder using the EEG or linear system. Brain Paint, which is also on this. They did research into addictions at UCLA using Brain Paint. Brain Core is another one. And the other thing you should know about linear systems, so the brain is a non-linear system. The brain is actually a chaotic system by nature, so it's not predicted what will happen next. That's a chaotic system. And it's also non-linear. So many things are happening simultaneously. And so again, with this first generation of neurofeedback, because you couldn't give all the feedback simultaneously, you had to segment it out and use it in a linear fashion. So you, as the trainer, also decide, like if someone is showing on their QEEG that they have anxiety and depression, you've got to decide which you're going to do first, and then you do the other. And for most for the most part, most linear systems have to be done in office because you have that trainer setting protocols. And so the next generation, dynamical systems. So what's the technology breakthrough that happened that allowed a new generation of neurofeedback systems to come into play? And that's the speed of computers getting to the speed of the human brain. And these are home computer systems. We're not talking about like giant computer systems that are used by, research centers and corporations. We're talking about home systems. So when computers got to the speed of the human brain, then you now have the opportunity to fix two problems, you could say, to be able to gather what is maladaptive in real time and show that to the brain in real time. And then the big other leap in opportunity is that now the expert becomes the human brain rather than the external trainer deciding what to do with the information of what is maladaptive. Now you can let the brain do that, which is what it's designed to do. The brain is designed to constantly take in information through our sense perceptions and then use that information to optimize its performance, to use energy efficiently, to decrease pain, to problem solve. And so now you have the opportunity for a technology that can operate in the nonlinear fashion that the brain does in real time with the brain as an expert. And so Dr. Val Brown, who is the creator of the neurooptimal system, he realized he worked on protocol systems back in the day, but he envisioned that you could actually design a more elegant neurofeedback system that would actually be synchronized with how the brain naturally changes. But he had to wait until computers got to the speed of the human brain, and then he designed dynamical neurofeedback. And Neurooptimal right now is the only dynamical system, but I'm sure at some point in the not too distant future, some other big thinker is going to create another dynamical system. So this is a picture of the neurooptimal system. There are two leads, active leads, C3, C4, references on clip to the ears. And then there's a grounder, just taking that electrical data from the scalp to the system. And so one of the things to understand is that this is not forcing any state change. So this system is purely about giving the brain a cue when the brain is performing a function so that it can identify for itself what is maladaptive. And the thing that we all understand in the world of mental health is that part of our big problem as humans is that we develop habits. We become habitual. And we understand that trauma and the real issue with trauma is not the initial traumatic event. It's that the brain becomes habituated to assuming that that traumatic event is also happening in the here and now, right? Take simple cues, we get triggered, right? And then that body is going into, that whatever strategy it used to keep itself alive. And so just to say a little something about headband and consumer neurofeedback products. So when it comes to the world of neurofeedback, you really get what you pay for. And so like people will say, well, Natalie, I found a neurofeedback device on Amazon that's only $300. Like, can't I just get that? And so just to speak to what happens with a headband product is that basically what you're doing is it's like the protocol systems, only even more simple, because you don't have the precision of data collection at the speed of the human brain the way you do with protocol and the dynamical neurofeedback. So remember, we're talking we're trying to collect data that's happening in microseconds, and we have to give feedback immediately. And so anything that is like a wireless headband and it has an app, you can know that that's too slow. You're missing a lot of information. And so basically what it is doing is it's inviting the brain to go into a state change in the present moment. But once you take that device off, it basically then goes back to what it was doing before. So you can think about it as like, it's like crutches. Like when you've got the crutches, you're like walking differently, and then you take the crutches away and you're going to go back to however you were habitually doing things before. So they definitely can have a role. It's helped people with like having a slightly better meditation practice. There are things about it that are beneficial. It's just a very different category of product and also outcome. And again, because neurofeedback is an unregulated term, you can call it neurofeedback, and then people get super confused as to like, shouldn't it help my anxiety? It's a neurofeedback system. Another thing people like are entrainment systems. They're often auditory, and basically what you're doing, it's like a tuning fork. And it's getting your brain to resonate with a frequency that the auditory is giving you. And again, you'll go into that frequency, and then when you go off of that, your brain just re-engages in its habitual patterns. So again, has a role, very helpful, but a very different outcome than professional neurofeedback. And the last system I'll mention, because a lot of therapists have heard of it, is the lens system. And that's like a 5-minute session. It's actually microstimulation of the brain. So again, very different than neurofeedback because you're adding something to the brain. It definitely plays a role. I talked to a psychiatrist who has the biggest neurofeedback clinic in Egypt, and he said he has a lens system, and he's like, people either love it or hate it. So some brains really gravitate to it and find it really, and other people are like, no, get me away from that thing. So, like with a lot of interventions, different people respond differently. So we're going to dive a little into the research on neurofeedback, and just to say, the research is definitely accumulating. There's more and more, but we're not yet at the point at which we're having these big, robust, double-blind studies. It's still in that experimental phase, very important. Although I will say, just as an aside, a few years ago, I discovered that the UN health insurance added neurofeedback as a benefit for people who had PTSD. So I thought that was a big win, but it's still very, in the early stages. And most of the studies, really 98% of the studies, have been done on protocol or linear systems. So ADHD is a big one that's been researched, and I'm really kind of confused by the studies at this point. The American Academy of Pediatrics in 2012 recognized neurofeedback as a level 1 best support intervention. And since then, they've backpedaled. And in 2024, there was a systematic review that came out with very mixed outcomes, and basically saying we don't support neurofeedback for ADHD anymore. And I tried to kind of really get in there to see why would they get those results, because we serve a lot of ADHD families, and kids do really well with neurofeedback, our system. These studies are not on our system, and so I'm like trying to kind of figure out what is going on. One thing they did note was that when the studies used standard protocols for ADHD, they did see statistically significant results. So again, it may be that there just isn't enough normalization of what the protocols will be and for how long to get the consistent results across studies. They also mixed adults and kids together, And I see mixed results with adults. I see very consistent results with kids. And we can talk more about that if you want to, as to like, why would that be? But that's kind of the mess that the ADHD research is in right now. Some positive, some, we don't see the results. As I mentioned, epilepsy was the first thing that was studied, seizures. Migraines and pain management. There's been a number of studies. And then a big one, as I mentioned, anxiety, PTSD, depression, could be in there as well. And one interesting community that uses the system I use is it's called ISIS. It's the Canadian Veterans Association. It's basically a peer-run support for post-traumatic stress. And they've integrated this neurofeedback into their peer program, which has been very successful, in part because there's no like doctors involved. And so it gets to be kind of normalized on a peer-based level, I think, which has really added to compliance and outcomes. And as I mentioned, Dr. Vanderkook, he's doing research on PTSD. Typically, I see really good results with 3 to 6 months, depending on whether it is PTSD or complex PTSD. So as we all know, complex PTSD is a very different condition than just someone who has an isolated post-traumatic stress event in adulthood, the latter being much more easy to resolve. But I thought I would tell you 2 stories of clients. So Terry was a woman, a client of mine, who she had her mother and her sister die in the same year. And so it was very traumatic for her. And she had been a therapy client of mine. And then she came back to me because she was like, Nellie, do you think the neurofeedback could help with, my grieving process? And I said, absolutely. And so she did a home program, and she was very disciplined. She did her neurofeedback every single day. And then when we checked in, she told me this funny story, which was that she had a terrible fear of driving on the New Jersey Turnpike. And she would usually take a Xanax before she'd get in the car. And she said she had gotten into the car and she was driving down the New Jersey Turnpike and realized almost at her destination that she'd forgotten to take her Xanax, and she was totally calm. And that's often how people will report the changes, because we're working on the automatic functioning brain. And I'm going to go into in much more detail how this works, but typically how people see the outcomes is it's in hindsight. Oh, I forgot to scream at that person that I normally scream at. Or, oh, wow, I slept through the night. Oh, I didn't smoke today and I forgot, I forgot to, and it's really the brain's regulated. So it's not asking for that usual, crutch or tool that it usually uses to regulate. And that's often when people kind of wake up and realize, oh yeah, I am much calmer, is that kind of event. And then Jennifer was a client of mine. She had an isolated traumatic experience. She had a horrible car crash in the snow. Thankfully, she was fine. She was the only person in the car. It totaled her car. But then she had, understandably, panic attacks when she thought about driving. And so she decided she was going to do a combination of cognitive behavioral therapy and the neurofeedback. She came to me for the neurofeedback. She was doing the CBT with somebody else. And over about 4 months of the combination of both, she was able to get back behind the car wheel, start driving. And then that was in the spring. And then she let me know that following November, after the first snowfall, that she had managed to drive in the snow. and didn't have any panic attacks. So isolated traumatic experiences are easier for the brain to re-regulate because it's primarily a brain habit issue. There isn't also the mind habit issue that we get with developmental trauma, where the sense of self and one's view of the world and safety in the world and safety within oneself, right? Those things merge. That habituation of the autonomic nervous system and that belief structure. And so those two things have to be worked on simultaneously when you're working with developmental trauma. Now, sometimes I'll get people coming for neurofeedback who've done a lot of therapy, and they'll say things like, I know my issues, I know my toolkit, and yet I'm still having X happen. And it's often very much a nervous system reaction. And that's when just doing the neurofeedback can be very effective for people, because they've already worked on the mind piece. And so addictions is another area that's been researched. UCLA has done a number of studies. This one was the alpha theta protocol, which is used in a lot of addiction treatment centers. So that's become a common feature in more progressive rehab centers, is adding neurofeedback to a 12-step program therapy. And I'll just kind of quickly go through these. Head injuries are my favorite because they don't have a lot of supports. And because the neurofeedback is about showing the brain what it's doing in the present moment, right? That's what that brain needs in order to keep doing its healing work. And so really see nice progress with people with headaches, sleep problems, memory problems, can't look at screens, are exhausted. Those things tend to resolve pretty quickly with neurofeedback. OCD takes longer, and it's really interesting. Years back, I noticed that OCD was a very different animal than other anxiety disorders. And just about a year or two ago, they, now are doing much more sophisticated, brain scanning. And they've shown that the OCD neural networks is very different. And so very much helped by neurofeedback. It's just longer. And I'm always encouraging people to bring in a behavioral program as well. And so attachment and adoption issues. And maybe I'll save this and I'll talk about this a little later once I explain how it works, because I think it would be more meaningful. And we already kind of talked about the depression. Okay, so back to our therapy pain points for a minute. Oh, looks like we have a question. Oh, sorry, I wasn't even looking at the questions here.
This is the first question,
Oh,
Natalie.
this is the
You're
first one.
able to
Okay,
view it, though. You don't need me to read them. You can see it.
I can see it. Yeah, thank
Okay,
you.
great.
Is this why rule of thumb is more P preferred for OCD?
I don't know if the wording makes sense. You were just commenting that OCD takes longer. So I was just wondering if that's why ERP is more the preferred treatment for OCD. And I just also wanted to know if you had any insight about pediatric neurofeedback for OCD.
Yes. I mean, I don't have a comment on the ERP piece, but I will say that definitely, young brains have so many unassigned neurons that if you give them the opportunity to see what they're doing that's maladaptive, those brains go to work to rewire. And if we don't see the changes, and I'm going to talk more about this, but now we're really understanding too that the gut plays a big role in some of these more challenging mental health issues. And so if I'm not seeing shifting quickly, like within month, 2 months, then I'm going to have them, I want allergy testing done, look at the health of their microbiome, because it's all interconnected. And so sometimes neurofeedback becomes the thing that helps us identify that there is other biological issues that need to be addressed. But definitely neurofeedback for OCD in kids is super helpful in my observation. And so Emily, yeah, if you want to just shout out if there are any more questions, just because all I can see is the slideshow.
Okay, I will do.
Okay, great. So I want to go back to our therapy pain points because this now feeds into the like, well, why does neurofeedback help these issues? So being stuck in therapy, difficulty opening up, accessing their feelings, or if they're easily triggered, if it's a kid or a family system that's been unstable, chaotic, lives from crisis to crisis. So you feel like you can't do any therapeutic work because there's just constant kind of bombs going off. Or your own burnout, which is a real thing for us. You know, we're empathizers and we too can, you know, get dysregulated emotionally. And so knowing that there's support for us as well, you know, recognizing like, do we have good boundaries? Are we overly invested or overly identified emotionally with our clients? And the reason is because all these pain points have to do with an overactive stress response. And so I'm going to use the stress response as the example or logic for why the system that I use, the dynamical system, neurooptimal, why it works and why it works so broadly.
Natalie, Jessica just popped one more question in there regarding OCD, and she's wondering if you recommend specific equipment for OCD in children.
Yeah, so what I would recommend is if someone is doing protocol neurofeedback, which is that first generation, I would recommend they go and see someone who has done a lot of OCD neurofeedback brains because you need expertise there. So 10 to 15 years of doing neurofeedback and specifically doing OCD would be my recommendation. And then if they're using the system that I'm using, in some ways, I would recommend that a little bit more because then you can do more sessions and you can do it at home, assuming it's a family system that's fairly organized and they can self-administer the sessions. I would recommend that because I also then recommend a parent does sessions as well. And I'll just go into this now. You can look at the stress response, right? Because we know nervous systems are connected. And so beta nervous systems, our children, they have sensors in the alpha, parents, primary caregivers, to sense, are we in danger or are we safe? And so when you have a parent also doing the neurofeedback and they're re-regulating into that zone 2, then that communicates to the beta nervous system, you're safe. And so whatever changes that beta nervous system wants to make to be in regulation, I'm safe and secure, it will do more quickly and be more stable in. We always see the best results in kids when a parent also does the training, hands down. And so for that reason, I'm more biased towards. Now, there are some systems, protocol systems you can do at home as well. The challenge is that you have to set different protocols. And some of them, I think the EEG is one where you can switch protocols because the parent's nervous system obviously is going to be different than the child's in terms of what needs to be augmented or inhibited in the brain waves. But this is part of why I love the neurooptimal system is because, you know, you don't have to mess with setting protocols. But that's my recommendation in terms of neurofeedback systems. And also because OCD takes longer, it's much more cost effective to do sessions at home. So that's another reason why I would make that recommendation. And so now to just kind of dive into something we all know about, right? The stress response. But I want to talk about it specifically in terms of the brain and how the brain defines safety and danger. So danger for the brain is bodily harm in less than a minute. So I need to run, I need to punch, I need to play dead. And I've been thinking a lot about how the fawning response and appeasement fits into this, but we'll put that aside for a minute, because this is the limbic brain, right? So this is our survival brain, and it operates independently of our prefrontal cortex, which is our brain that is our willful self. It is our planner. It's our brakes, right? And so when we get a trigger for danger, right, we're going to go into at whatever age we learned that response: punch, run, play dead. And so what neurofeedback is doing, and so let's go to the next slide here. So I'm going to talk about my system now. So you have the leads, active leads on C3, C4, clipped to the ears and a grounder. And the data is just going through the wires into that little box, the amplifier. It changes it voltage into numbers. And then it feeds it into the software and a dedicated, in this case, Surface tablet or Surface laptop. And that software is looking for state change. It's looking for the electrical dance that the brain does right before it performs a function. And in that millisecond, it interrupts music that's playing. So the feedback is auditory. And the reason for that is the primary sense perception that we use to note danger, because we can listen even when we're asleep, right? And that survival brain is always listening. And so we're using that natural orientation response to cue the brain in the exact millisecond. So there's an interruption in music. And what happens for that brain is that it notes change, right? I was listening to music, now it stopped. Something's different. And in that millisecond, it will orient to the present as well as internal events. So to use a conscious analogy, if you're sitting and having lunch with your friend and you didn't realize it, but you went off into thought and were thinking about a fight that you were having with your husband, and then your friend says, Emily. And in that moment, you orient to the present everything that's taking place. So the fact that you were lost in a daydream, the fact that you're having lunch with your friend, and now you have a choice, right? You can either focus on your friend or you can go back into your daydream. And this is exactly what we're giving that automatic functioning limbic brain when the music stops, is we're giving it the opportunity to see what it's doing, particularly see what you're doing that's maladaptive, meaning it's not aligned with the here and now needs, right? And then now you get to make a decision because you're now awake, so to speak, right? You have choice. And so the brain will go, oh, well, if I'm going into a stress response, right, we're using that as the example, hyperarousal, but now I'm oriented to the present and I see I'm sitting in a quiet room and there's no danger. Why am I doing hyperarousal? So then it's going to shift in the moment. And millisecond by millisecond during a neurofeedback session, that brain is shifting and changing based on what it's seeing about itself. And so you'll find during a session or after a session, people will feel more relaxed, a little more focused. For people who are type A go-getters, who push themselves and don't sleep enough, they often start to feel really tired at the end of the session. And they'll say to me, Natalie, this is not working. I'm exhausted. And I'll say to them, well, do you push yourself? How many hours of sleep are you getting? Right? And they're like, well, yeah, like I talked to a woman the other day and she was like, I was telling her, you know, like, do you get enough sleep? Do you push yourself? And she started laughing. She's like, Natalie, I have a 40-minute break. I'm chomping down a burrito and then I'm going skate skiing. Yeah, I definitely don't get enough rest. And I said, well, your body is telling you something right now. You might not like it, but this is the feedback it's giving you consciously, because if we don't have awareness, we can't create change, positive change. And so sometimes what comes up at the end of a session, people don't like, because they're like, I still want to just get 5 hours of sleep a night. Like, I don't want to sleep more. And it's like, well, okay, it's a choice, but your body is now saying, I'm tired. Like, could you please feed me with sleep, which is one of the most fundamental needs we have, right, after breathing. And so people will notice various things shift during a session. And then over time, so this is brain training, and this is a big departure from the previous neurofeedback systems, is that because this system is giving real-time feedback to the brain millisecond by millisecond, and that brain is able to optimize itself over and over again, it's actually a teaching tool. We're teaching the brain something, which is, gosh, we're kind of forcing you to come into the present moment and see what's going on. But gosh, aren't you also seeing that when you do that, you get good information and you can make better decisions and use your energy more efficiently? So the brain gets that positive feedback of, wow, this is a really effective way to make decisions, which is come into the present moment, gather data, see what my current needs actually are, and then make a decision. And that's when, going back to my fancy graph, right, of the hyperarousal or the hypoarousal, that's when we calm down and we cheer up and we start to live in the zone of regulation. And it's really cool to see that when people are regulated, right, that's when they're naturally more open. So in talking about attachment issues, right? So when we have a traumatic event at birth or shortly after birth, right, and our nervous systems are set up to protect, right? And for a lot of babies, right, we're going to go into that collapse, freeze response, right? Then we don't attach to others, right? And so what happens when kids who have that attachment disorder do neurofeedback is, or others of us who maybe don't have that severe, but we use that freeze response as our interpersonal protective habitual strategy. What happens is just when we start to be regulated and the brain is over and over again learning, good data is in the present, I'm safe, I'm safe, I'm safe, right? Then that brain goes, oh, I want to connect. And what happens is very organically, people start to connect, right? So parents of adoptive kids will say like, wow, the tantruming is like much less, making more eye contact, using words to express needs, right? Being able to tolerate physical touch and wanting, asking to be held, because that brain is now in this state of regulation where we're open and we are interpersonal animals, right? We want to connect, we need to connect. And so when the brain is now in the zone of safety and secure, I'm safe, right? Then it wants to create greater security and can follow through. And this is also when we heal, right? I mean, there's so much data now showing that refugees, it's only when they're in a safe environment, the refugee camp or relocated, that their trauma symptoms start to manifest to then be healed, right? Because the brain needs to register, I'm now in a safe place. And then that natural wanting to heal starts to manifest. And so with this system, it's really teaching that brain and the best way to be, which is come into the present. And that's when people really can go from that reactive style, however that manifests for them, whether it's fighting, mental rumination, difficulty sleeping, anxiousness, or the depressive, why bother? It's hopeless, self-sabotage, freeze response, not taking appropriate risk, all those things can start to shift because that brain is now in the right place, because it's practicing the practice. We're teaching it through this training, which is all the data is in the present moment. I'm going to make the best decisions. And so now to talk a little bit about what gets in the way of good results. So we are a whole system. And so neurofeedback has definitely helped me become a much more holistic healthcare provider, as I mentioned before about the gut. And really the neurofeedback is like, it should work like gravity, especially with kids. So if we don't see the results, then there's something in the way. And so what are the things that get in the way of the brain re-regulating and stabilizing that? Lifestyle things. So diet, thank goodness they just banned red dye number 5. I mean, it's like horrible for kids who have sensitivity. Food sensitivities, just an unhealthy diet, a lot of ultra processed foods can get in the way, lack of exercise, not sleeping enough. Those things can get in the way of results. And then another one is just not ready for the change. And we all know this as therapists, right? I mean, people make great strides when they're ready to make the great strides. They're ready for it. And so that's a big part of whether we'll see the results from neurofeedback. And typically it's that they forget to do the sessions or they're too busy. And so then they don't access it. Sometimes with anxiety, and I see this more in women than men, but it's really identifying that hyperarousal of the fight-flight energy as their go energy. That's my identity. That's how I get things done. And so when they do the neurofeedback and they start to calm down, they start to get re-arouse an anxious response because they think, I'm losing my edge, I'm losing my energy. And so for those people, it might be that they're just not ready. It's not a great tool for them, or they need some psychoeducation about how much more productive they can be if their nervous system is regulated and they're able to focus and sustain focus and they're calmer and they're not as reactive. But typically people who are really identified with their anxiety, they tend to stop the neurofeedback around 6-8 sessions. And so another variable is a chaotic family system or stressors. And I'm going to share the story of Maya here, which she has sensory processing issues, very difficult time with transitions, emotional regulation. And I said to the dad, they decided they wanted to do the neurofeedback. And I said to the dad, I said, we'll know it's working because she's probably going to start to ask for it. And so sure enough, about 4 sessions in, they were doing home training. She started to request it. I want to do the brain thing. I want to do the brain thing. And so that was very encouraging at first. And then I checked in with them after a few more weeks and things got super busy and there was a lot going on in the house. And gosh, they just hadn't been able to get the sessions in. And all of her, dysregulation behaviors were re-arising. And so in this case, the parents, household decision-making was really the extrinsic constraint that got in the way of Maya doing her sessions. And eventually they had to just do the neurofeedback sessions out of the house and take her to a clinic because they just couldn't get organized enough to administer them at home. And then other underlying health conditions can be also a reason why we don't see the results or what we expect. So people who have mold exposure, they've been exposed to heavy metals, hormone imbalances, gut issues, not absorbing nutrients. One population we serve that I haven't mentioned so far, but is an important one is autistic kids. And they, especially so with autistic kids, what we see change is sensory processing really improves. So, and this is not something I really fully understand, but basically what's happening with those neurodivergent brains is too much sensory information is going from that unconscious to conscious awareness, and it's flooding them. And so then they have to have strategies to try to diminish the input of those sense perceptions. And so sensory processing becomes much better when these kids do the neurofeedback. And emotional regulation also really improves, sleep really improves for these kids. But it's definitely one of many tools for kids who are on the spectrum, but it is an important one, and it's really nice when parents also get to do it because, it's very stressful. And so again, those parents also get the resource of their nervous systems re-regulating. And so another thing that I'll say just about why kids can see results more quickly in them is because what I talked about before, which is that, there is the mind piece, there is the belief piece, and we can absolutely trigger our own hyper or hypoarousal of the stress response with our own beliefs and our own self-talk. And so because kids don't have a strong self-narrative, as their brains re-regulate, their sense of self just kind of goes along with that. And they don't have a strong story that is going to reassert that dysregulated habit. And so another reason why they, in my observation and my hypothesis is that that's why they can shift faster than we see in adults. Okay, so, and one thing I should say too, because this fits in with the autistic kids who have sensory processing issues, if they're very sensitive to touch and they don't like sensors or anything on them, the really nice thing about the system that I use is that you can train them when they're sleeping. And so I had a mom who had two kids, one on the spectrum and the other one was kind of neurotypical. And her son on the spectrum, she would train him at night, and really, I think it was like the first 3 or 4 months, his sessions were when he was sleeping. And then as that sensory processing improved, they were able to switch to daytime sessions. So, and also because you don't have to visually look at a screen, it's auditory. That's another nice advantage. Because with some kids, getting them to focus is the reason why, and their inability to do that is the reason why you're having them come to do neurofeedback. So the fact that they don't have to actively do anything in order to get the results is another, win for those of us administering. So, and so lastly, this is my daughter, excuse me, well, she's 20 now, so maybe like 5, 6 years ago. And so I just wanted to show you the setup. The music that you hear in the background is the music of the neurofeedback. So you can see the sensors on the sides. And she's playing her video game on mute. And so the neurofeedback is happening, and then so she gets to do something else with her eyeballs. And so it's also a nice kind of way to get cooperation from kids, is because they can be doing something else with their eyeballs. It makes it like, a win in that it can be something like, when they get to play a video game, or they get to like play with Legos, or kind of whatever is a fun thing for them. And so I think we've just kind of gone over this, but I'll just say that typically most clients do in-office sessions, particularly if they're doing the protocol neurofeedback, and they tend to do once or twice a week for usually 20 to 40 sessions. Sometimes it's covered by insurance. And for those who do a home program, it's definitely the preference for my ADHD autism families, adoptive kids. And then the system is sent to them and typically train. And as I mentioned before, really encourage parents to train as well. And this option, usually about 3 months, is kind of a typical, although, with the brain, there's no such thing. It's really an N of one. But kids tend to do really well with a foundation of about 3 months of sessions. Rentals are rarely covered by insurance. And then some people purchase a system, and these are families that, have very complex situations, and they know that they're going to need support for like a year plus, or they have high stress, chronic illness, and also just optimization of brain performance is really valued in the family system, and they have the resources to purchase. We do have families that purchase systems. So
Natalie, there was a couple more questions.
yeah, great.
A couple of folks did not get to see the video. I'm not sure if that's right. It played for me, so I'm not sure if maybe you can send it as an attachment to email and we can provide it to
Yeah,
everyone
yeah,
afterwards since it's so
exactly.
short.
And also on my YouTube channel, you can see videos, which you can see here on the screen. I have lots of videos, and some of which show the system and the system operating. So that's probably the best place to go.
And then the one question is, Jessica said it's kind of interesting for the entire conversation of neurodivergent brains. Do their brains at the end of treatment resemble neurotypical brains?
I mean, I'm not an expert, so I don't feel qualified to answer that. I would answer it this way, which is that the neurofeedback system that I use, the Dynamical system, basically what it's doing is giving every brain the opportunity to optimize itself so it is the most resilient and resourceful that it can be. Because really, when it comes to the brain and really this idea of like N equals one, like we're all our own unique population. And that's really, I think, the most helpful way to approach the brain, is that everybody is unique. And I've certainly witnessed this over and over and over again in people doing neurofeedback. What shifts for people? How much it shifts? Like I'm always surprised by, what each individual's brain expresses. And so, I mean, I would say that so one of the things we know about autism now is that they have a very different microbiome than neurotypical guts. And so I would say that you really have to look at what is happening in that whole system to know like what is possible to change for this individual. I will say that something that's pretty consistent across the autistic kids we serve is sleep re-regulating, much better emotional regulation, and much, much better sensory processing. And also language development, if there are those issues. And this is true for head injuries, stroke recovery as well. Any improvement in memory, language processing, they tend to happen more quickly when the neurofeedback is added. That was a lot of talking. Anybody have any other questions? Anybody curious about kind of how healthcare providers can use it for self-care?
I know that earlier, somebody asked the other participants in the chat, like, who is attending this training so that they can learn about using the neurofeedback system in the future themselves and who already has equipment and already uses it. And I've been wondering, how did you start being able to offer it in your practice? Like, can you just purchase one system and then offer it to clients um in your office? Is there a certain training you have to complete in order to do that? Like how would a
Yes.
therapist get started using it?
Yeah, that's a great question. And, it's very different for protocol neurofeedback. It's much more extensive training. There's a national organization. There are courses you have to complete. It's it's good. It's extensive because you are, tweaking people's brains. So that's a much more involved training. And it's a very large community. And so the NCIA is that organization. And then with the dynamical neurofeedback, with the neurooptimal system, because the system is fully automated, like the basic certification training that I teach, it's a 10-hour course. And so it's very easy. And so, yes, basically, people, typically when I work with therapists who are interested in it, I encourage them to try it themselves because that's just, that's just my philosophy, like experience it for yourself, expose some people to it, learn from that, as a starting place. And then, the equipment itself, you can lease it, rent it, or purchase it, and it's very easy to operate. 15 minutes, you know how to run successful sessions. And actually, which reminds me of one other thing that's really important to clarify. So with protocol neurofeedback, um, the sensor hookup is a very important part of the process because we don't pay attention to this, but we're always bombarded with electricity. So 60 hertz is in our environment. That's our outlets. Microwaves, lamps, all sorts of things are emitting. And that can get in, it's called line noise. It can get in the way. And so the hookup's really important. But with the system that I use, it has a canceling feature. So it blocks out everything that is not your electricity coming off of your brain. And so that also makes it a much easier system to use. You don't have to be so worried about the hookup. Okay, so here's someone's question. For the neurooptimal system, if parents elect to buy it, then are they able to learn how to administer it on their own at home? Yeah. No, they don't have to pay to be trained. It is in 15 minutes, they will learn how to use it. It's very user friendly. And that's really how they designed it. They wanted people to have access to it easily. So
And Natalie, you had told me before that when you have a family renting the program from you, they also can access one of the therapists who was trained in it once a week or something like that, so that if they're having issues with the machine or they're so that way, they're paying for the rental of the machine and having some check-ins with somebody weekly,
yes.
usually is the way that you do that, right?
Yeah, there's always someone there as a support. And one of the things that we strongly encourage, although we don't get, total compliance on, is the self-reporting checklists. And I should have had that as a slide. But if anybody's interested, I'll send you a copy. So we have a whole a whole list of variables, and we have people rate them on a scale of 1 to 10. Some of them are like issues around sleep, mood, what you eat, any addiction stuff, hormones. And then we have them fill it out once a month when they're doing our home program, and then they review it with their trainer. So we have them pull out their first one and then their second one. And this is really important because this is how it typically sounds when we check in around session 8 or 10. How are you doing? Well, I'm feeling better, but I'm not sure if it's the neurofeedback. I'm not sure it's because I ate that thing or I slept and so that's when we have them fill out the second checklist. And it's amazing how we as animals will forget pain, because people will look at the second one and they'll see 6. right? And it's on 10 is the worst, right? Don't feel safe in the world is now a 6. And then we go to the other one and they're like, oh, that was a 10. Oh yeah, that's right. Yeah. Oh, I forgot how. And so the checklists are such an important part of capturing all the changes that can happen. And then we also have another one, which is very particular to what you're working on. And then you rate it in terms of intensity, duration, and frequency, because those are the 3 variables in which the brain changes. How intense is it? How frequently does it happen? Intensity, duration, and frequency. So how long does it take place for? And then you watch those change, because the last thing I'll say about this, and something we really teach people in our psychoeducation, is the brain is a non-linear change agent, right? And we know this in psychotherapy, that when someone is coming in to work on, a traumatic experience, it's not going to be a linear every day, I feel slightly better, right? No, that's not how change happens. But that's kind of how we think. And so somebody is going to be like, okay, well, this neurofeedback is going to work because every day I'm going to feel slightly more calm, right? And it's like, no, that's not how the brain changes. It's a nonlinear system. So you may start to feel a little calmer, and then you might have a spike in anxiety, and then that intensity, duration, and frequency, those 3 variables are going to fluctuate. And so really preparing people to understand that nonlinear change is the positive way the brain changes. Anything that is linear is 100% predictable, and the brain is certainly not that. And we all know that in the world of therapy, but we think of popping pills and the pill does the thing and then we're good. Okay, so
You did miss
some
a
people.
question earlier. I wanted to just make sure that you saw it because it's up higher now. Catherine asked, are there any RCTs in progress studying neurooptimal or neurofeedback? Since we're still early, it's still experimental, not yet an
Yeah,
evidence-based.
I mean, there are definitely studies that are going on. Like there is a researcher at the University of Central Florida, and she bless her heart, she was going to study PTSD in college students, because in Florida, they have a lot of vets who go to college. But then she discovered something when she went to enroll, which is nobody wanted to talk about the fact they had PTSD. So then she had to change the design to stress. And then she got enough students. So she's studying the stress response, and she has done a couple of studies on ADHD using the neurooptimal system. So she's one researcher. There's a couple more that I know are in the works. And then this is kind of another topic altogether. The University of Florence just published a study using neurooptimal for tinnitus with really positive results, something we didn't even talk about. So it's really, if you know of anybody who's doing research and they're looking for, we're still at that stage of like, just trying to find somebody who has the resources, the research dollars, who's interested in doing the studies. And then the 2 psychiatrists who set up the OASIS program, the VET program in Canada, they have done a couple of research studies on anxiety and depression using the neurooptimal system that have been published. And those are the ones off the top of my head. But if you go, and I'll put it in here, if you go to the neurooptimal website in the very bottom, footer, you can see on the far right, there's research, and you can see some of the, because I'm not going to remember it all, optimal.com, you can see some of the research studies that have been done. There was someone who did a case study on adoption in there, developmental disorders. I know there's a bunch, but yeah, we're still in the beginning. Give us another 20 years.
Um, a couple of people asked for the checklist. I think maybe if you send that to me, we can just send it out to everyone who participated today, if that's okay.
Yeah, absolutely.
Yeah.
More than happy to share that. Are there any potential harms or side effects? Yeah, that's a really important question and one I should have covered. With protocol neurofeedback, the side effects are kind of over or under training. And so like, I'll give you an example. One of my clients who had PTSD and he couldn't access a neurooptimal trainer, so he did some protocol neurofeedback. And he reported that sometimes he would feel kind of a little bit too kind of heavy-headed at the end of a session. But so it's basically like you're encouraging the brain waves to shift. And if it's too much encouragement or discouragement, then sometimes people notice things like feeling sleepy, feeling kind of agitated, anxious. But the brain then resets itself. It's not like it's permanent at all. It's just the fine tuning. Because with protocol neurofeedback, you're really like dancing with the brain. You're not like, they'll present it as like, it's like this is standard, but every brain is different. So you're always looking for the feedback from the person about like what's happening that's working or if they need more support. And then with neurooptimal, I would say the side effect is that kind of what I said before about the person who was exhausted and they didn't want to feel their exhaustion, right? They might say, like, the neurofeedback did that to me. But again, the only thing the neurofeedback is doing micro interruptions in music. That's the only intervention that's taking place. Everything else is happening internal to your brain. And so things can come out like emotions, right? So if you are a repressor, right? And we know that takes a lot of energy to keep emotions down. And so for some people, they might have feelings come up that they don't want to feel. And so typically what they do is they stop training. And then, their strategy for self-care gets redone, which is the repression of emotion. Again, it's not a tool for everybody. I had a client who she rented a system from me because she was like a scatterbrain. She's like, I really want to focus. I need to write this book. And then she started training and she was like, Natalie, there's these feelings that are coming up. They're like really sad feelings. I don't want to feel these feelings. And so we were like, okay, let's stop training. And so that's what we could call side effects, although again, it's already internal to the system. It's just whether or not that person wants to experience that or if it's the right time to experience that. I had somebody who was one of those anxious overachievers, and literally 10 years later, after she quit her job and retired, is when she came back for the neurofeedback. So she did like 5 sessions, started to calm down, freaked out, stopped. 10 years went by, she retired, and then she's like, okay, Natalie, now I'm ready to calm down. So that's more the style of side effects with this system.
That's really interesting that she would do that 10 years later.
Yeah, she knew. She's like, I really do know that I need to be calm, just not yet.
I see one more question. We're at our end time, but she just wanted really quickly to remember the difference again between protocol neurofeedback and the neurooptimal.
Yeah, exactly. It's protocol or linear neurofeedback, and then neurooptimal is also called dynamical neurofeedback. And, I'll put my website in here too. I've got I have lots of blogs and educational. I also have other like copies of professional webinars I've done. So if you want to go under the who is it for, you can see clinicians, and there's some webinars there and also the YouTube. So yeah, lots of
Yeah, I
continuing.
remember watching one of your like 10-minute videos on what is neurooptimal versus other systems. There's a lot on Natalie's website. It's really helpful. So, my goodness, thank you so much for this, Natalie.
Oh, my pleasure.
There's a lot of feedback in the chat that they found it insightful and helpful, and a couple of folks here who'd never learned anything about neurofeedback before, which is why it was really Great. It was just exciting to be able to offer this to our Home Within volunteers, and more volunteers will be able to access it later in our CE library. So, you're reaching an audience that's also serving youth in foster care and former foster youth, and maybe, amplifying their ability to serve that population as well. So, thank you so much for your time and being here.
Well, thank you. And thank you everyone for being interested and, just keep learning. It's a fascinating topic. And if anybody has any questions, you can find my contact info on my website as well. And please reach out.
And I did put the link in the training to our evaluation. I believe an email goes out automatically to everybody who participated today. So even if someone signed off a couple minutes before I put that link in the chat, once you complete the evaluation, the certificate will go out to you. And Chrissy at homewithin.org, I put that email address in the chat also, and you can find her on our website. She's the one to reach out to if you have any trouble with that evaluation form or getting your certificate. I'll put my email address in there also, just in case. And give you all a minute to copy that if needed. And then we'll just wrap it up for today. Thank you again, everybody, for coming, and Natalie for presenting. It was so fascinating. I love hearing about it. And yeah, this is great. Thank you so much.
Thank you, Emily, and everyone have a good day.
Take care, everyone. Bye-bye.